Well, greetings and welcome once again to Coffee with Cade. My name is Kristen Young. I am the communications coordinator with the Cade Foundation, and I am excited to have this opportunity to host. So we're going to talk about the insurance mandates for those who are pursuing fertility treatment. So I have Ms. Davina Fankhauser of Fertility Within Reach, as well as Dr. Nathaniel Stanley of Moffitt Cancer Center. Welcome to both of you. Thank you so much for hanging out with me today.
Thank you.
Thank you. Excited.
Yes.
We're talking about insurance and just kind of, okay, so let's just kind of start with the basics. Like what does insurance cover fertility treatment? Like what are my options?
You know, it's a great question because that's where everybody starts is what's covered and what can I do and not do. And I would say most states, there is some coverage in identifying what might be going on. However, once there may be an insurance code that says this testing is being done because you're infertile, that typically isn't covered unless the state has an insurance law pertaining to fertility health care.
Key questions that I should ask my insurance company or ask my healthcare provider when it comes to figuring out insurance?
I would consider taking a really good look at your health insurance plan as well as your partners, if that's applicable. So even if you assume no fertility benefits exist, it's good to contact your employer's HR just to see if there are benefits that exist but may not be rolled out yet. There's a person I talked to who is starting treatment and contacted her employer first to see if any fertility benefits existed, even though it was clear on her plan that they did not. But it turned out the company had fertility benefits, but they hadn't rolled them out yet. They just forgot to. So once they were notified that the fertility benefits existed, that people wanted them, she was able to have them all rolled out for her and everyone else in the company. So I would start looking at your finances. You're going to have to make some out-of-pocket expenses, but also talk to your HR department. I would even do that before talking to your insurance provider, because as Devin has said, some of the diagnostic tests will be covered. So it's good to have an idea after those diagnostic tests to know what is my treatment plan from here and what can I expect to have paid for. Because the more specific you can be with your insurance company, the more they can tell you what is and is not going to be covered.
Mm-hmm. But I always tell people when you talk to the insurance companies, you also want the details. What are their guidelines? Because just because you have benefits in your plan doesn't mean that you're automatically going to receive them from the insurer. They always have these guidelines you have to meet in order to be eligible for the benefit.
Based on your knowledge, are there any services or is there anything that no insurance that like insurance just will not cover when it comes to fertility treatment?
Well, what I would say is even states with an insurance law for benefits, not everyone is going to have coverage because there's a federal law known as ERISA that says small businesses and self-insured employers don't have to follow state mandates. And most states don't offer it for people who are on the state health insurance plan. So there's always a large population in every state, even when there's a mandate, that won't have benefits. So you have to be very aware that just because you have insurance benefits in your plan doesn't necessarily mean that it's available right away. Those are some of the differences. I don't know if that answered your question exactly. Dr. Stanley, what do you think?
I would also say, just from what I've heard from people, medications are pretty common to not be covered by any insurance, as well as the freezing and storage of eggs, sperm, and embryos. Those are typically not covered by any insurance.
Awesome.
And sometimes it can be vice versa. I know insurance plans that will cover the genetic testing of embryos, but they won't cover the IVF cycle to produce the embryos. Or they'll cover IVF, but they won't cover the medication. Well, you can't do IVF without medication necessarily, effectively. So it's really interesting that, sometimes not everything is covered, but usually, depending upon how a bill is written, for the states that do have coverage, it will include medication in there. But we've learned so many things over the years that each state has better coverage because we're learning the mistakes of past states where they didn't get everything covered.
Sure. So that's definitely good to know. So in general, regardless of your insurance plan, regardless of your prescription plan, if you are pursuing IVF, medications, you for the most part, you can expect not to have coverage for any of the medications associated with your treatments.
It depends upon the way a law is, but,
Sure.
or the way a benefit is offered. There are some companies that they give you this dollar amount, and so people often use that toward medication as well. Whereas there are some plans, if they use that toward the treatment, you can get discounts on medication. There are different pharmaceutical companies that have discount programs. So it's also kind of knowing how to be savvy and how to use your money that you may have as benefits.
Then for Claire, go ahead.
I knew one person who was able to use GoodRx as a way to find a discount on their medication. It was not very many people were able to use that, but one person was able to use that and at least get a discount.
That's great.
Got it. So let's say I live here in Maryland. So if I am pursuing fertility treatment in another state, is there an option for me to, because I'm receiving treatment in another state, maybe get supplemental insurance in that state? Is that an option, and maybe they have better insurance options than through my current employer or through my home state?
Well, supplemental insurance is usually purchased by the employer.
Okay.
And so it would be up to them. Well, Dr. Stanley can talk about some of the programs that are out there, I know.
Plans that are typically offered directly to employers as fertility benefit packages, such as like Progeny, has a package that they offer, but it's not directed to individuals or couples, it's directly to the employers. So they're facilitating healthcare packages for the entire employee base of that employer. But that's one supplemental type of insurance. And then some of the medications, there's a lot of specialty pharmacies that offer some discounted medications if you get them through that pharmacy. And there's within clinics themselves, there's also what are often called shared risk programs, which in the simplest sense is the clinic essentially takes on some of the financial burden should your treatment regimen not produce a live pregnancy. So they essentially share some of the financial burden if you don't get the end result.
Yeah. One thing I want to say about those shared risk programs is there is always a lot of small print to read and to think about. So and I think they can be fantastic programs for people. But I always suggest when you talk to the financial person at a clinic, you take everything home and you review it instead of making a decision right there.
Right on the spot.
Talk over the cost.
Love it, love it, love it. So quickly, because believe it or not, we are getting close to our time. So Nathaniel, if you can share a little bit about what you do with Moffitt Cancer Center.
Yeah, so I have been with Moffitt for about 4 years now. And when I graduated with my doctorate in December last year, I went full-time over at Moffitt, and now I'm the administrator for their community benefits, which is what they report in their IRS form for the Schedule H to maintain their nonprofit status. And I also am a biostatistician and a spatial analyst for the hospital.
Love it. And I honestly don't know what all of that means, but it
I
sounds
work with
fantastic.
numbers. I work with numbers.
Very smart. It's great.
I do not have the medical background, but it sounds great. Yes, it sounds fantastic. And Davina, can you share a little bit about Fertility Within Reach?
No, I'm just kidding.
That's our time.
So we are a national nonprofit that helps increase access to insurance benefits for fertility treatment and fertility preservation. So we do this by helping people with insurance appeals or writing legislation or working with groups around the country and providing them with tools and resources to help them create an advocacy movement in their state and to get legislation passed in their state. We support, all the efforts that we can. And then we also have a grant program called Banking on the Future, where we cover the first year of storage for adolescent oncology patients and for gender transitioning patients. And then we've negotiated a discounted rate that they pay afterwards for a certain amount of years. So I love our group. There are lots of resources and tools, including Cade Foundation, that we provide for people just to make this a little bit easier.
Yeah, absolutely. And honestly, and that's what it's all about. It's about making sure you understand that there are resources there. There is support out there for you. You may have to do a little digging, may have to do a little bit of research, but help is available to you. So thank you so much for all the work that you do and for being supporters of the Cade Foundation. Before we go, it is Coffee with Cade. So I want to know what's in your cup.
I do have coffee.
You have coffee. Okay, love it.
Cafe Du Monde coffee is very good, very strong.
Love it. Love it. Love it. Love it.
I admit I don't do coffee.
That's okay. That's okay.
I love tea. And
okay.
And during COVID, I drink a cup of this every day.
Hey, I love it. Absolutely. Absolutely. And for me, it's just good old water. Okay. It's
awesome.
And I drink plenty of that every day.
Perfect.
Awesome. So really quickly, if you could just share, if people want to get in contact with you, or if you have links to maybe some resources where people can find some more information, please, Davina, if you want to go first and share.
Sure. So our website is www.fertilitywithinreach, all one word, .org. And then you can also email us at admin, ADMIN, at fertilitywithinreach.org.
Love it. Love it. And Dr. Stanley?
Yes, I don't have my own website, but I am on LinkedIn, and I'm very much interested in connecting with people and continuing to do advocacy work in this arena. So I'm publishing my dissertation research, and Devin and I are actually going to be collaborating on a publication as a result of having our conversation today. So I'm looking forward to working with Devin and anyone else who might be interested.
Thank you.
Awesome.
Good too.
I love it. Well, once again, thank you both for hanging out with me today, for sharing some information. Thank you to all of our viewers for continuing to tune in. We are here every first and third Monday of the month at 12 noon. So mark your calendar, set your alarm, make sure you check in. We have a wide range of information and resources that we are bringing right to your phone, to your computer screen, wherever you are. Just make sure you follow us on Facebook and Instagram. And that's it for this week. But we will see you in just another couple of weeks with some more from Coffee with Cade. Take care.
Thanks. Bye.